Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, Questions 1 to 12. You hear a nurse talking to a patient called Alex Martin about managing worsening asthma. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Martin. How are you feeling today?
Good morning, nurse. I've been having a hard time breathing lately, especially when I exercise or during the night. I've had these issues before, but it's getting worse.
I'm sorry to hear that. When did these symptoms start to get worse, and have you experienced any wheezing or coughing along with the shortness of breath?
It's been about a month now. I do notice some wheezing, and there's also a dry cough, mostly at night. I didn't think much of it at first, but now it's interfering with my sleep and activities.
I see. Do you have a history of asthma, or has anyone in your family been diagnosed with asthma or other respiratory conditions?
Yes, I was diagnosed with mild asthma when I was younger, but it hasn't bothered me much in the last few years. My father also had asthma, and my younger sister has it as well.
Asthma can be hereditary, and it sounds like your symptoms might be related to it. Asthma can flare up or worsen due to triggers like allergens, exercise, cold air, or stress. Have you noticed anything specific that triggers your symptoms?
I've noticed that exercise and cold weather seem to make it worse. I've also been around a lot of dust recently because of some renovations at home, and that's when things really started to get bad.
Dust can be a strong trigger for asthma. Based on what you've described, it sounds like your asthma may be worsening, but we'll need to do a few tests to confirm. I'll get the doctor to examine you shortly, and we'll conduct a spirometry test, which measures how well your lungs are functioning.
What's involved in that test?
Spirometry is simple. You'll be asked to take a deep breath and then exhale forcefully into a machine that measures the airflow and lung capacity. It helps us determine if there's any obstruction in your airways, which is common in asthma.
That sounds straightforward. I hope the test gives us some answers because I'm worried about how much worse it's gotten.
It's good that you came in before it progressed further. We'll also check your oxygen levels and listen to your lungs with a stethoscope to see if we can hear any wheezing.
Good morning, Alex. The nurse has given me an update on your symptoms. It sounds like your asthma might be acting up, but we'll confirm that with the spirometry test. In the meantime, can you tell me more about how often you're experiencing symptoms and how severe they are?
It's been happening almost daily now, especially during physical activity or at night. I've had to stop exercising, and I'm waking up several times at night because I can't breathe properly. It feels tight in my chest.
That must be uncomfortable. Based on your symptoms and history, it's likely that your asthma has become more active. We'll do the spirometry test today to assess your lung function. I'll also prescribe you a quick relief inhaler, which contains a bronchodilator. This will help open up your airways when you have an asthma attack or feel short of breath.
Will I need to take the inhaler all the time, or just when I feel breathless?
The quick relief inhaler should be used when you feel symptoms coming on or during an asthma attack. However, based on the severity and frequency of your symptoms, you may also need a daily controller inhaler. This contains corticosteroids that reduce inflammation in the airways and help prevent symptoms. We'll see how your spirometry results come back and decide on a long-term treatment plan from there.
That makes sense. I'll definitely use the quick relief inhaler as needed. Is there anything else I can do to manage the symptoms?
Yes, there are a few lifestyle changes that can help. Since dust seems to be a trigger, try to minimize your exposure by keeping your living space clean and using air purifiers if possible. Avoid exercising in cold air or during high pollen days, as these can trigger your asthma. If you can, stick to indoor exercises until we get your symptoms under control. Managing stress can also help, as stress can exacerbate asthma symptoms.
I'll definitely try to reduce my exposure to dust and be careful about exercising outdoors. Should I avoid certain foods or environments?
While food allergies can sometimes trigger asthma, it doesn't sound like that's the case for you. However, avoiding smoky areas and places with strong odors, like paint fumes, would be wise. Also, stay hydrated and avoid cold drinks that can irritate your throat and airways.
Thanks, Doctor. I'll make those changes and use the inhaler as prescribed. I'm hoping to get back to my normal routine soon.
You're welcome, Alex. With the right treatment plan and a few adjustments, you should start feeling better soon. We'll keep monitoring your condition and make changes as necessary. If your symptoms worsen or you have any concerns, don't hesitate to reach out.
I appreciate that. I'll follow up after the tests and let you know how things are going.
Sounds good. Take care, Alex, and we'll see you soon.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Sarah Johnson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Sarah Johnson. Please come in and take a seat.
Thank you, Doctor.
I see from your records that you recently underwent surgery for a leg fracture. How have you been feeling since the procedure?
Overall, I'm feeling better, but I'm still dealing with some pain at the surgery site. The area around the incision is quite sore, and there's some swelling in the surrounding tissues that hasn't fully gone down.
It's common to experience discomfort and swelling after surgery. Can you tell me more about the pain and swelling? For instance, when does the pain tend to be the worst, and how would you describe the swelling?
The pain is usually worse in the evening and after I've been on my feet for a while. It's a deep, throbbing pain that seems to radiate from the incision site. The swelling is persistent throughout the day, but tends to get worse as the day progresses. It seems to reduce somewhat when I elevate my leg, but it never completely disappears.
I see. It's important to manage the pain and swelling effectively. Have you been following the post-surgery instructions we provided, and how are you doing with your physical therapy?
Yes, I've been diligently following the instructions and attending my physical therapy sessions regularly. My physical therapist has been helping me with exercises to improve mobility and strength. Despite this, I still find it challenging to move my leg freely. The therapist reassures me that some discomfort and swelling are normal during the recovery process.
That's right. Recovery from surgery can vary from person to person. Have you noticed any changes in the incision site, such as redness, increased warmth, or any unusual discharge?
Yes, there is some redness around the incision, and it occasionally feels warmer than the rest of my leg. I've been worried it might indicate an infection, although I don't have a fever or any other systemic symptoms.
It's good that you're monitoring these changes. Redness and increased warmth can sometimes be signs of infection, but they can also be part of the normal healing process. I'll need to examine the site to determine if there's any infection or other issues. Additionally, I might order a follow-up X-ray to check the alignment and healing of the bone.
I understand. I'm keen to make sure everything is healing properly. The discomfort and swelling have been a bit discouraging, and I just want to ensure there are no complications.
That's a sensible approach. During the examination, I'll look for any signs of infection or complications and assess the overall healing progress. If needed, we can adjust your pain management plan or suggest additional strategies to alleviate the swelling.
I appreciate that. I've also been concerned about how long it will take to get back to my normal activities. Is there a typical time frame for recovery after this kind of surgery?
Recovery times can vary, but many people start to see significant improvements in mobility and reduction in pain within a few weeks to a few months. It depends on factors like the severity of the fracture, the type of surgery performed, and how well you're following the rehabilitation plan. The goal is to ensure that the bone heals correctly and that you regain full function of your leg.
That makes sense. I'm also curious if there are any specific activities or exercises I should avoid during this period to prevent any setbacks.
Yes, there are a few activities you should avoid, particularly those that involve heavy lifting, high-impact movements, or any exercises that put excessive strain on the healing leg. It's best to focus on low-impact exercises that improve range of motion and strength without putting too much stress on the leg. Your physical therapist will provide guidance on which exercises are appropriate for your stage of recovery.
I'll make sure to follow that advice. Is there anything else I should be aware of during my recovery?
Just continue to monitor your symptoms closely. If you experience any sudden increase in pain, swelling, or if you notice any new symptoms such as fever or significant changes in the appearance of the incision site, make sure to contact us immediately. It's also important to keep up with your follow-up appointments so we can track your progress and make any necessary adjustments to your treatment plan.
Thank you, Doctor. I'll keep an eye on those symptoms and stay in touch if anything changes. I'm looking forward to getting back to my normal routine.
You're welcome, Sarah. We'll work together to ensure a smooth recovery and help you get back to your usual activities as soon as possible. I'll arrange for the follow-up X-ray and schedule your next appointment. In the meantime, if you have any questions or concerns, don't hesitate to reach out.
I appreciate all your help. Thank you again, Doctor.
You're very welcome. Take care, and we'll see you soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an overview of laparoscopic pain mapping as a diagnostic tool for identifying the source of chronic pelvic pain in women. Now read the question.
Laparoscopic pain mapping is a diagnostic laparoscopy performed under local anesthesia, with or without conscious sedation, aimed at identifying sources or generators of pain in women with chronic pelvic pain. At times, finding the cause for pelvic pain becomes very difficult. This is especially true in cases of pelvic scar tissue, endometriosis, fibroids, and other issues that can be explored through a pain mapping procedure. The patient is given some strong medication to make them drowsy. After injecting local anesthetic medicine into the navel, the physician will insert a small bubble of gas inside the belly and introduce a laparoscope, a very tiny diameter instrument, inside the belly to look around. Another small instrument is inserted lower down on the belly and used to touch organs inside. After the patient awakens, they will indicate whether they experience pain when specific organs are touched. For instance, if endometriosis is causing pain, it will be tender when touching the affected organ with the instrument. Moreover, when the patient experiences pain on the right side, it can be difficult to distinguish whether the pain is in the ovary or the appendix. Therefore, pain mapping can help identify the exact source of pain and assist the physician in choosing the appropriate procedure.
Now look at question 26. You hear a healthcare provider discussing recent findings on interstitial lung disease. Now read the question.
Interstitial lung disease is an unusual but sometimes deadly form of continuous scarring of lung tissue. New research by a cardiologist has shown that the condition may be linked to low vitamin D levels. Calcidiol is the biologically active form of vitamin D that is hydroxylated by our kidneys to form calcitriol, which circulates as a hormone in the blood, playing a major role in regulating the concentration of phosphate and calcium. Its anti-inflammatory effects modulate our immune system and also have anti-fibrotic effects, regulating various genes involved in fibrosis or scarring. Therefore, if you have low levels of vitamin D, that may be a contributing factor for the lung disease. However, many cases of interstitial lung disease aren't related to any particular factor. Thus, vitamin D levels might be an unusual risk factor that is relatively easy to evaluate. New research will focus on correcting vitamin D levels, and then assessing whether the patient's condition resolves or stabilizes. We know that the activated vitamin D hormone has anti-inflammatory properties and helps regulate the immune system, which can be disrupted in interstitial lung disease. There is also evidence in the literature that vitamin D plays a role in obstructive lung diseases, such as asthma and COPD. We have now found that this association exists with this scarring form of lung disease as well.
Now look at question 27. You hear a healthcare professional explaining pyloric stenosis in newborns. Now read the question.
Pyloric stenosis is a problem that affects babies between birth and 6 months of age and causes forceful vomiting that can lead to dehydration. It is the second most common problem requiring surgery in newborns. The lower portion of the stomach that connects to the small intestine is known as the polaris. When the muscles in polaris thickened, that narrows the opening of the polaris and prevents the food from reaching the intestine. This kind of narrowing of the lower portion of the stomach is known as pyloric stenosis. Typically, this problem occurs in newborn children between 2 to 8 weeks of age. As the polaris thickens, the stomach opening is blocked. Therefore, the food cannot move into the intestine. This causes a patient with pyloric stenosis to vomit, which could result in several problems. Dehydration is the major problem caused by pyloric stenosis, since the regular vomiting devoid the fluids for the nutritional need of the infant. Secondarily, minerals such as potassium and sodium are lost through vomiting, making the baby weak. Mainly the firstborn male babies are vulnerable to pyloric stenosis. Smoking or intake of tobacco during pregnancy doubles the chance of pyloric stenosis in infants. Bottle feeding is also another cause for developing pyloric stenosis. According to findings, infants giving antibiotics in the first 15 days of their birth have the greatest risk.
Now look at question 28. You hear a cardiologist discussing the impact of testosterone levels. Now read the question. According to research conducted by a cardiologist, higher levels of testosterone in postmenopausal women is the main cause for their cardiovascular disease. Higher testosterone level has been suggested to be associated with increased risk of cardiovascular disease, increased triglyceride insulin resistance, and increase in the risk of developing breast cancer in postmenopausal women. Testosterone is a type of hormone known as the androgen in the male. Therefore, a higher level of this hormone in women causes high blood pressure, adverse lipid profile, and other unforeseen health issues. Usually, testosterone becomes more dominant in women after the menopause. However, screening for hormone levels during such health conditions is not in practice at present. Symptoms of an excessive level of testosterone in a female include excess facial and body hair, deepening of the voice, acne, increased muscle mass. Female androgen insufficiency, which is characterized by the presence of reduced androgen level in circulation, leads to an impairment in sexual drive, reduced libido, depressed mood, and signs and symptoms of limited androgen exposure, such as decreased muscle mass, reduced bone density, and decreased sense of well-being. An appropriate level of androgen may play important roles in metabolic, psychological, and sexual functions in women. Now look at question 29. You hear a discussion about a multidisciplinary approach to managing pain without the use of narcotics. Now read the question.
Hello, doctor. Is there a comprehensive approach to keeping pain under control, avoiding narcotics?
According to a pain expert who has established a multidisciplinary pain clinic engaging physicians, acupuncturists, massage therapists, psychiatry arrests, and patients to kick the opioid habit, one fundamental practice followed is signing an actual contract with a patient mentioning that they will not use any kind of narcotic while they are getting prescriptions. Moreover, they will also not do anything outside of getting another prescription from any other provider. We will tell them that we will be randomly doing urine examination, and we tell them if they keep getting positive urine tox screens, we are not going to provide them medical services. So then they have to go and find another provider. Occasionally we get a positive tox screen and we confront the patients, reminding them not to use narcotics again. And we warn them, if it happens next time, they cannot come to our clinic anymore.
Now look at question 30. You hear a doctor explaining the dual role of inflammation. Now read the question.
Hello, doctor. What can the nose information teach us about how the human body repairs itself?
We have the ability to smell things because of our olfactory system. However, according to research by a utility or just for the patients with chronic sinusitis, inflammation on overdrive compromises the system. The greatest problem in patients is just the ability to smell due to inflammation. As in the case of chronic sinusitis, for instance, it's evident that chronic inflammation is bad for the olfactory system, at least in the early stages. To begin there, repairing processes. It is surprising that inflammation actually plays a beneficial role in early repair of tissues that allow us to smell. Therefore, inflammation is a normal and essential process in repairing. But the question is how to regulate inflammation to preserve the good and mitigate the bad.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on irritable hip syndrome. You now have 90 seconds to read questions.
Dear colleagues, patients, and family members, I am honored to be standing in front of you today to speak about a condition that has become increasingly common in recent years: irritable hip syndrome. As a doctor, it is our responsibility to help shed light on illnesses that affect our patients and to offer guidance on how to manage these conditions. Today, I am here to educate you on the subject of irritable hip syndrome and help you understand its effects, symptoms, and treatments. Irritable hip syndrome, also known as acute truncheon synovitis, is a condition that affects children between the ages of 3 and 10 years, but can also be found in adolescents and adults. This condition is characterized by inflammation of the hip joint, which causes pain and discomfort to the patient. It is caused by a viral infection or an injury to the hip joint or surrounding muscles. Most of the cases of irritable hip syndrome are mild, with symptoms subsiding within a week or 2. However, sometimes the condition can persist, causing prolonged pain and discomfort, which may require medical intervention. The symptoms of irritable hip syndrome vary from patient to patient, depending on the severity and duration of the condition. However, most patients exhibit the following symptoms: limping pain in the groin or hip area, difficulty in walking or standing, fever, and general discomfort. As a doctor, it is crucial to identify these symptoms and establish a proper diagnosis to ensure proper treatment. To diagnose irritable hip syndrome, the doctor will listen to the patient's symptoms, perform a physical examination, and order tests like blood tests and X-rays. It is essential to establish a proper diagnosis to differentiate irritable hip syndrome from other conditions that may cause similar symptoms, such as septic arthritis, hip joint infections, or a vascular necrosis. The treatment of irritable hip syndrome usually involves medication and rest. The doctor may prescribe non-steroidal anti-inflammatory drugs (NSAIDs) to help alleviate pain and reduce inflammation. In severe cases, the patient may need to use crutches or a wheelchair to reduce pressure on the affected hip. It is important to note that rest is of utmost importance during this time to ensure proper healing of the inflamed joint. Physical therapy is another way to manage irritable hip syndrome. The patient can undergo exercises and activity restrictions to alleviate pain and improve mobility. Physical therapy helps to strengthen the muscles around the hip joint, providing better support. Preventative measures can also help in managing irritable hip syndrome. It is essential for patients to maintain healthy diets, stay active and physically fit, practice good hygiene, and avoid contact with individuals who may have infections that can lead to irritable hip syndrome. To bring these ideas to life, let's delve into the case study of a patient who experienced irritable hip syndrome. Sophia, a 9-year-old girl, was brought to the hospital by her parents complaining of pain in her left hip. She had difficulty walking and had developed a limp. Sophia's parents also reported that she had a low-grade fever for the past 2 days. The pediatrician suspected that Sophia was suffering from irritable hip syndrome and took blood samples and X-rays for diagnosis. The results were consistent with irritable hip syndrome. Sophia was prescribed NSAIDs and advised to rest her left leg for 2 weeks. Physical therapy was also prescribed to help her regain the strength in her muscles. After 2 weeks of rest, Sophia's pain had subsided and she could walk comfortably without any assistance. Recent studies have shown that irritable hip syndrome has a higher incidence in young boys than girls, and it is mainly caused by viral infections. Researchers have also discovered that early diagnosis and treatment can lead to a better prognosis and shorter recovery times. Future research aims at developing new diagnostic tools to ensure that patients receive timely and accurate diagnosis. In conclusion, irritable hip syndrome is a condition that can cause considerable discomfort and pain to patients. As doctors, it is our duty to stay informed about the latest developments in diagnosing and treating this condition with prompt and appropriate medical intervention and proper rest and care. Patients can recover quickly and return to their normal lives. Let us work together to support and care for those living with irritable hip syndrome. Thank you.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Sarah Williams discussing antibiotic resistance. Now read the questions. You now have 90 seconds to read questions.
Today we are speaking with Dr. Sarah Williams, an infectious disease specialist, about antibiotic resistance, a growing healthcare concern. Dr. Williams, could you tell us what antibiotic resistance is and why it's a pressing issue?
Antibiotic resistance is essentially when bacteria evolve to become resistant to the antibiotics designed to kill them. This makes it difficult to treat various bacterial infections, and we're seeing this phenomenon increase rapidly. It's especially concerning because antibiotic resistance threatens the efficacy of surgeries, chemotherapy, and many other medical treatments. It's a global issue affecting everyone, but unfortunately, it hasn't garnered the attention it truly needs.
What's the situation like in the US?
In the United States, we're seeing a significant number of antibiotic-resistant infections. The CDC estimates that every year about 2.8 million people get an antibiotic-resistant infection and more than 35,000 die as a result. It's a growing problem, and healthcare systems need to adopt strict antibiotic stewardship programs to curb this issue.
Can you describe an individual case that you've handled?
Certainly. A patient, let's call him John, came in with a seemingly straightforward skin infection. He was initially given a common antibiotic, but the infection didn't improve. Further tests showed that the bacteria were resistant to multiple antibiotics. We had to use a last resort antibiotic, which has severe side effects. Thankfully, John recovered, but it was a close call and highlighted the grave risks we're facing.
What complications arise in treating antibiotic-resistant infections?
The complications are many. Patients may need to be isolated to prevent the spread of resistant bacteria, and treatment options become limited. There's also an economic cost. Treating resistant infections is often more expensive and requires prolonged hospital stays. Another issue is the psychological toll on patients, who often become anxious and stressed, which isn't good for recovery.
Do you see patients who have chronic issues due to antibiotic resistance?
Absolutely. I've had patients with recurrent urinary tract infections that are increasingly difficult to treat because the bacteria are resistant to multiple drugs. Over time, these chronic infections can affect the kidneys and overall well-being. It's a very challenging situation for both healthcare providers and patients.
What can be done to combat antibiotic resistance generally?
There's a lot that can be done. Public education is key. People need to know not to misuse antibiotics. We need better diagnostics to quickly identify the right antibiotic for an infection. Also, healthcare providers need to adopt strong antibiotic stewardship programs. On the research side, we need new antibiotics, but that's a long process and not very lucrative for pharmaceutical companies. Government intervention and public-private partnerships could stimulate more research.
Well, Dr. Sarah Williams, thank you very much for sharing your insights on this critical issue.
You're welcome, and thank you for giving me a platform to discuss this urgent healthcare concern.
That is the end of Part C. You now have 2 minutes to check your answers.